My name is Jeane. I'm here because I have two children. These are their pictures, Hannah and Travis. Both have been classified in the autism spectrum disorders. My daughter Hannah is 19 now and she is autistic. And my son, Travis, 14, has Asperger's syndrome and attention deficit hyperactivity disorder. The funds, the Medicaid cuts that are being considered would have a devastating impact on our family, particularly my daughter Hannah. She is more severe and could not live on her own. She was three and a half when she was diagnosed, and we started on some waiting list around the time of she was 5, and it was more than 7 years before we got any services at all through the class program. Her progress had been very slow up to that point, but through some of the therapists and the in-home support, she made a lot of progress. She became more verbal. Some of the more difficult behavior issues that she was having diminished, and she was more appropriate in public settings. It was a godsend to our family. Then, each year, while we were on the program, the last 3 years in particular, things would be cut back a little bit. Well, we revised it. We're not going to have as much money for therapies. And my husband and I both worked. We have private insurance. We paid for everything that we could pay for. We paid for a lot of things that were not covered. But these were getting into things that our insurance would not cover, and things that were just making a huge difference for her. So to see them slowly taken away was very frustrating. I learned about the ICF homes, which are intermediate care facilities. They're Medicaid funded and typically privately run, but Medicaid funded. They're a home, so there's just a limited number of kids there, and they're all, again, in my mind, children because of their mental age. It was the hardest thing I've ever had to do. It was to put her into this home. But it was also the best decision that we ever made, because the structure, the staff, the caring, and the services that they've provided have really turned her around. The home that she's in has been a lifesaver. I really truly feel it's actually saved our family's lives, because I don't know what would have happened to us physically as well as emotionally, and what would have happened long term to my son mentally because of the things that were going on. If it were to close, and my fear is with the Medicaid cuts, a lot of these programs may have to close, I don't know what we would do. There's a lot of other kids in the home, a lot of disabled. They're not just in San Antonio, throughout the state. They're not there because they're lazy. They're not there because they did anything, so to speak. They're there because they were born or perhaps injured and have that's with them the rest of their life. They will never be able to work in the same way that you and I can. They're never going to pick yourself by the bootstraps and go out and get a job. It doesn't work this way. And if we can't take care of those people that are the most vulnerable, I don't know what it says about us as a people. I really don't.